Itagat entetitab Health Watch, akaine nyungo current chariot. Ebet tabrani, kengalale nyersetab imanda, agimiten akwamboka, kobun kovao. Welcome to the show, Kwamboka.
Thank you very much. Thanks for having me.
You're welcome. Most of the time, people say that domestic violence tends to increase when families spend time together. Why is that the case?
In a normal family setup, you'd have people doing different things during the same period, so that you'd have during the day both spouses are far away from each other, carrying out different duties. So by the time they come in together in the evening, most of the time they're tired, they're looking forward to sleep. So during this COVID-19 pandemic, it's happened that families are spending more time together because, one, there's the dusk to dawn curfew, and because of a bit of economic challenges, that there are no jobs, so they end up spending more time together. And it's during this period that there's a bit of disagreements. Sometimes it's more disagreements, then they end up having a bit of friction, which turns into violence. And one party becomes the violated one.
What can couples or families do in order to reduce this GBV?
I think between spouses, it's more of communication, open communications that I speak to you, you listen, you speak to me, I listen, we communicate in an effective way. Because most of the time, it turns out that where there's disconnect in communication, one party is not able to understand the other. The reaction may be one party ends up being beaten, in which case that's what we are seeing right now, that there's a bit of domestic violence, intimate partner violence in households.
What are the other types of GBV?
So there are several types of GBV. One, there's sexual violence, which manifests in the form of sexual assault, defilement in cases of minors, and rape in cases of adults. There's economic violence, there's psychological violence, and emotional violence.
It brings in psychological effects. What are some of those psychological effects?
The psychological effects actually manifest. Imagine a case where a minor has been defiled. You can imagine how that will impact them psychologically. And that, when I say a minor, that begins from any age below 18 years. We have cases where it happens to a 2-year-old, a 17-year-old. So psychologically, how does that impact them? Because manifestation appears in the form of this withdrawal from their social circles. They tend to be more quiet. Some end up having nightmares because of such actions. And that's where psychological assistance is heavily required. Psychosocial support is a very big component in assisting victims of violence. In cases of economic violence, psychological and emotional, because they manifest, in emotional it manifests with abuses. I will tell you today, you're stupid. The next day, you look ugly. The next day, the abuse keep increasing. So how does that impact as an individual? Self-esteem issues, interaction changes. So how they carry themselves is they tend to demean themselves, because that is the kind of violence that they receive. If continuous abuse makes an individual having sense of self-doubt. So abuse, emotional abuse, psychological abuse, is affected by when someone keeps saying nasty things towards you.
So we can generally say that GBV is also caused by a buildup of underlying issues.
Surely, I agree, it does,
Now, Dr. Kagunda explains further on emotional abuse. Let's get to what she said.
Emotional abuse is to do with the way the way we relate with other people and the words we use. There is physical abuse and emotional abuse. Emotions is mainly to do with the words we use, insulting other people, intimidating them, whether they are children or adults, isolating them or yelling at them, and all that kind of thing, which comes with emotional abuse. Sometimes we are calling it chronic aggression abuse because of the words that you use or the way you treat that person. You may not beat them, no physical violence involved, but it's mainly verbal abuse here. And emotional abuse, sometimes it happens, and often it happens right in our homes. Let's talk about children and the ways that we parent them, or the way we treat them, whether parents or otherwise. Emotional abuse at that level takes place in different ways. For example, a child is being told, you are good for nothing, you will amount to nothing, you are a failure, you are a dog. You know, a lot of words that, or maybe a child has not performed well in school. In schools, emotional abuse also comes when there is a lot of bullying in our schools. When all kind of things are done to them. At the home front, we see that emotional abuse may take place in a relationship where a boyfriend or a girlfriend or a husband or a wife keep insulting the other person and using very harsh words towards the other person. Sometimes it could be intimidation, even in relationships. Sometimes it could be being denied the basic things, even finances and all that kind of thing. So emotional abuse takes place in different relationships, in different setups, where, like I have said, a lot of words or being denied or being bullied or being intimidated or being threatened happens. So ultimately, if you are being told you are a failure and you are good for nothing, ultimately you start feeling that you are a failure and you are good for nothing. And you define yourself that way. So your self-esteem, like you said, it gets affected. You devalue yourself because you start thinking, for sure there must be something wrong with me because of this narrative I'm hearing almost on a daily basis about who I am. So self-esteem. The other thing, the other effect of this kind of thing we are talking about, emotional abuse, is that there is behavior change for the person who is receiving it. Sometimes they may withdraw, and maybe it's because of they feel they are worthless and all that. Their behavior is likely to change, where they socially they withdraw. They want to live in their own cocoon. Sometimes they become very aggressive, like sometimes children will become very aggressive. So when they go to school, they start fighting other children because sometimes there is a lot of anger. They don't know what to do with it. So they will start fighting other children. So there is that social behavior we are seeing. But also another thing is that it may lead to anxiety disorder. Now this is where mental health is coming in. It may lead to depression. It may lead to post-traumatic stress disorder because of sometimes the fear. You know, you have this fear of being in this environment which is very abusive. And so when you think about it, there's a lot of fear, there's a lot of worry, which may also bring in physical illnesses.
Let's talk a little bit about statistics. What have you as COVAL seen so far since the beginning of COVID-19?
I would like to say first that COVAL has an ongoing toll-free line, which we started on 27th April to date. And so far, we've received 60 cases of GBV being reported to us, of which we support the survivors through the reporting mechanism, through the referral system to be able to get support. And it's notable that on the first day of setting up the toll-free line and making it publicly known, within the first few hours, we had 72 phone calls from members of the public just inquiring, what is this that you're talking about and how can we get further assistance? And that was a big indication that something is going on the ground.
72 cases on the first day?
On the first 72 calls within the first few hours of setting up the toll-free line and making it known to the public.
And so how many calls do you receive in a day?
In a day, it varies. So based on what is happening, we can, for example, we can say we are having a show on radio throughout the country.
Yes.
And as the show is ongoing, people are just calling, saying we have this problem, we have this problem. And so far of the cases that we've been receiving, they've been quite numerous. And I would break it down to several types of violence. For example, we've had several domestic violence cases, defilement cases. We've had matters relating to land, where women's land rights are being violated. We've had cases where there's cases involving children. We've had intimate partner violence cases, and not necessarily where this one is being battered, but in terms of women receiving threats. We've had cases where women are reporting they're having mental health issues. Sadly, we're having cases reporting of FGM ongoing, right? We've had missing persons cases. So it's within the 1 or 2 months that we've had the toll-free line, we've seen actual cases reported to us have been 60. And of these cases, it brings us to an indication that something is going on the ground. There's a gap somewhere. And through the reporting, we also receive survivors telling us, I'm trying to report, there's a big problem. ABCD is happening. I'm not able to take the cases to the police. When I take the cases to the police, some say I'm not able to report because initially they're saying the courts are not open. So the police say, we're not taking the case. Other instances are told, we don't have P3 forms. So on our end, we see it as a worrying trend. Yeah.
And that's also linked to some of the services that you provide as COVAL.
Yes.
What are those services?
So I would say that COVAL, through our strategic plan and all the interventions we have throughout the country, one of the services we're giving right now is pro bono legal advice to survivors. We're giving pro bono legal assistance in terms of court representation because we have a pool of pro bono lawyers who are able to go to court and assist the survivors. We're offering psychosocial support to these survivors because by the time they're going to court and a matter is ongoing, say in relation to sexual violence, there's a traumatic experience that they've gone through. So they need sessions of counseling prior to them being heard in court, right? We're also working in communities. Also, we are working with communities, with community activists and paralegal, and we are giving a bit of support to certain families. From previous times and currently, we are working with intellectually challenged women and girls and their caregivers. These are girls with multiple disabilities most times, and they are an extreme vulnerable group. So we've been giving basic food package to them, sanitary towels. We're giving personal protective equipment because who else will support them? Because we've seen there's a bit of the economic support on their end and their families has gone down. So COVA is coming in to support them.
Okay.
Yeah.
Now, most of the services that you provide is geared towards women. But right now we are seeing a rise in cases of gender-based violence against men.
Sure.
Are you also targeting them?
We are. You see, we're a women's rights organization, but that doesn't exclude men from our services. Sometimes the callers who call are men saying, this is happening, I need ABCD. This is happening, I need this kind of support. And we're able to come through for them. Even the cases in court, we have cases. We have actually an ongoing case of a man who has multiple disabilities, and we're giving pro bono legal support. So our services also extend to men as much as it's structured for women. We're also extending support to men, for sure.
With that in mind, men were told, even if your wife hurts you in the house, keep it to yourself. There was this socialization. Does that mean that we are slowly coming out of our cultural values and socialization?
I can imagine how difficult it is for a man to come out and say, hey, this is happening to me. I am experiencing violence in my own home and I need support, because how society has bred them, how society is structured to say that a man, in what we commonly say, mwanaume ni kujikaza, mwanaume ni nguvu. I appreciate when a man comes out and says, I need support, because it has taken a lot. And surely they need that support. But at the same time, I see the numbers are still dwindling, because not very many men will come out and say, I'm being battered. I'm experiencing a certain time of violence. Most of the time, it's women who are coming out. And for women who are coming out, for sure, it has taken up a lot of courage, because we have seen where women are experiencing violence but are also not reporting, and that's also an issue we as COVA we're experiencing. So both men are not reporting, women are not reporting, but on the higher scale, it's women who are reporting. Men are still a bit silent about the violence experiences.
Other than the societal pressure or socialization, is there any other reason why people are not reporting?
Numerous reasons, and I'd start with women are not reporting cases for the simple reason that there is no safe space for them to run to.
Yeah.
You can imagine a woman who's experiencing intimate partner violence in the evening during the dusk to dawn curfew. Where will they go? One, there's a curfew.
True.
If they get out, the police are hovering around to see who's violating the rules, right?
Yeah.
There's no place for the woman to go when they need that support. So they will say, I'm living with my partner, sina mahali pa kwenda. So they will just stay in the house. Two, sometimes economically they're at a disadvantage. So the feeling is that if I report, I'll be out of my home. Where else am I going? Going back to the point that there is no safe space. We've seen instances where reports are not being made also because of the dusk to dawn curfew, that women are feeling, I can't get out to say anything. There's a curfew. I have to stay silent about it. We've, in other cases, it's just that resignation of, I'll receive no help. I have tried previously, I have gone to report, nothing is happening, so why should I say it right now? And that's where COVA, we are mounting efforts on advocacy to let people know that there's a way to report. The government had issued 1195. There's a way to call and report. COVA has a toll-free line, which we will share. There's a way to call and say, this is happening, I need this kind of support. And that, I think that is what I would urge all stakeholders, that mount several efforts on advocacy through advertisement, through whichever means you can, to let the masses know that there is help, there's a way to report. As much as there may be challenges here and there, but it begins with something. Yeah.
You've talked of seeking help, that some people might not come out and seek help. In the past, the government had said that every police station will have a gender desk. Is that the case in all the police stations?
I would say it's not. Surely there's been the effort that in many, there's a gender desk, but not all. Think of it this way. There's a gender desk in most police stations in Nairobi, but you realize Nairobi is one county. There's 47 other counties. That those police stations in those rural areas, do they have gender desks? And if they have a gender desk, who is sitting on those desks? Is the person sitting there empowered enough to know how to deal with a survivor of violence? When a survivor of violence comes to them to report, or just come to the police station generally, how are they handled? Because to date, sadly, we're having cases of women being told, "Iyo ni maneno ya nyumba, go back. Go talk among the elders. Go deal with in the family." Sadly, that is what is happening. Surely the government has made effort, but more needs to be done. That there's a gender desk in every police station in the country, and the police officers who are in this gender desk are sensitized. Capacity building is done to them so that they have information on how to deal with them, survivors of violence, that they have the capacity to give psychosocial support, because we usually say that when a survivor comes to talk about the issue, to report, their first point of contact will determine whether or not they want to proceed with the case till the end. So imagine I'm a survivor, I'm coming to report to you. How you will treat me as being my first point of contact will determine whether I'll have the zeal to follow through and seek justice, because I've been on the receiving end of the violence. So if I'm treated badly, I'll be disheartened. But if I'm encouraged that there is a case here, we're going to follow up, something can be done, then I'll have that hope that surely something can be done.
So that also speaks a lot about who's your first line of contact.
Exactly.
Do you as an organization help train these individuals who are now going to be the first line of contact?
So through several COVA interventions, which I will mention, COVA has been able to engage several fast responders in matters of violence. I'll give an example. In our Access to Justice program, we have interventions like we support court users committees. In court users committees, we work with the court officials, we work with the magistrates, police officers, you work with the chiefs. So these are the people who will give fast assistance. We're able to sensitize them of vulnerable groups, what is happening to them, and how probably they will be able to respond. We work in communities. We work with the chiefs. We work with the community leaders, village elders. We sensitize these people to also assist us pass the message. So we're able to tell them, this is happening, and this is how we need to respond. We work with lawyers who we train, our pro bono lawyers. These are the people who will give help the survivors access justice.
Yeah.
We work with the community activists themselves in the community, deep in the community. These are the people we've trained that the community will come to them first and say this is happening. So the community activists can be able to tell them, we go report at the police station, we can be able to go to the hospital. So we work with several categories of fast responders in matters of violence for sure. Yeah.
Kindly take us through the process of receiving justice. Right from the start, once someone has reported that this is happening to me.
So we call it the referral pathway.
Yeah.
So starting from the point that violence has occurred.
Okay.
The first part is to go to the police station and report, right?
Yes.
When you go report, you'll be able to be given an OB number, the normal process. And then there'll be a P3 form, right? Where someone is not able to reach the police station fast, they should be able to go to the healthcare facility. And I would narrow it down to matters sexual violence, for example, because we find that the public is not exactly aware of what should happen.
Yeah.
Go to the hospital within the first 72 hours. This is 3 days. The importance being you'll be able to be treated, evidence will be maintained, you'll receive treatment that goes into prevention of pregnancies and HIV, which is very important in any case. Within this 72 hours, you should be able not to tamper with any physical evidence. And when I say this, I mean do not shower.
Okay.
Go as you are.
As you are.
Should you need to change clothes, store them in a khaki bag.
Whatever clothes you had on.
Whatever clothes you had on in a khaki bag. Khaki bag, mostly envelopes. Yeah?
Yeah.
Go with that because evidence might still be in the regalia you are wearing, right?
Yeah.
After that, the P3 will also have to be signed at the hospital, right?
Yes.
At the hospital, see, it's very important because the doctor who gave you assistance, who treated you, that is a witness in court.
But what happens when, like you said, in some instances, P3 forms are not there. The police isn't supportive enough. What happens?
Following through.
Yeah.
I understand, and we've had so many cases where people are saying, tumeambiwa tulipie P3 form. Following through. But this is where also COVAL comes in. We've supported so many survivors where they come tell us we're having a challenge at the police station. This is where we send our teams to the police station.
Yeah.
We write to the OCS. Following through that justice is served at that level.
Yeah.
So that when they get the P3 forms, when it is signed in hospital, the police are able to investigate, compile a report, the perpetrator is arrested, and the matter is taken to court. So when it's taken to court, a charge sheet will be drawn with the offense saying that ABCD, this is the offense you committed on a certain date, and the hearing process goes through. But the first 3 days of reporting and going to hospital are crucial because that is the evidence that will be used in court. Of course, there are those instances where someone is not able to report within the first 72 hours.
Why is that?
Because fear. For different reasons. You can imagine every other reason that can make someone not report in the first 72 hours. There's that fear.
Yeah.
There's that aspect of what will people think of me? What will they say? What the family can say we're not reporting. And that is something I would generally urge the public, report. These instances where we are having families having discussions.
Yeah.
Money is changing hands. There's that forgetting that there's someone who's suffering. What is happening to them?
Can we also link the lack of reporting to the mental state of the individual during that time?
Sure, for sure, I agree. When someone is a victim of violence, something happens to them internally. Mental health is an important issue, but it is affected because of such violence, so they may fail to report immediately. But I would imagine we have someone around us. They should be able to assist, right? And assist in terms of reporting and encourage you to report. But it starts with also the individual speaking out about it. So failing to report also attributed to failing to speak out about matters violence, especially when they happen to us. Normally we think these things happen to other people.
Yes. Doesn't happen.
But when it comes down to you, that strength of saying, it has happened, I need help, is quite important. Because as we've said, the importance of those 72 hours, because it may also save your life.
True.
Yeah?
Now, as Kwamboka has said, GBV can result in mental problems, and one of the mental problems that arise from GBV is anxiety. Let's get a clip from Dr. Julia Kagunda about anxiety.
We say that anxiety it's common, you know. Preparing for this interview this morning, I was anxious, you know. So anxiety is common to all of us. But anxiety disorder is when there is excessive anxiety. When there is excessive anxiety and it interferes with our day-to-day performance or work, then that is what we call anxiety disorder. Other ways that it's when there is excessive worrying. Again, worrying is normal for you and I. But when there is excessive worrying, and maybe it has gone for more than 6 months, that this person is so anxious, they're just worried every time. And at the same time, they are intrusive thoughts that keep coming into your mind, you know, negative thoughts really that keep coming, or excessive fear. The other symptoms is feeling very agitated, feeling always is this agitation. As a result, you find that you have a dry mouth, you are sweating a lot, your hands are always wet. If you ask to do something, you almost panic because there is a lot of agitation. Other time it could be panic attacks. Maybe a thought crossed through their mind and they had a panic attack where you can't move, you feel almost paralyzed by whatever is going on. Also restlessness, even for children. You see a child who can never sit still. It's like they are always on the move. Or even for adults, you are somewhere in a gathering and this person is always restless. You know, they can't just settle. They feel like they need to be on the move. There is fatigue, excessive fatigue, where persons feel very tired and tensed and the whole body feels, you know, they always for a long time you say, I'm tired. There is also irritability, where somebody says, you know, or you realize they are always irritable. You say something small, you step on their toe and they hit the roof. There is a lot of tension, muscle tension, like I said. Sleeping disorder. Sometimes some people sleep a lot, others don't sleep. Sometimes some people avoid social gatherings. So it could be a product of emotional abuse, physical abuse, trauma that they have gone through. The loss is not well processed. So anxiety could come as a result. It could be financial burdens that one is going through. They don't know how to deal with it. So there are all these triggers from our environment that can make one to suffer from anxiety disorder. If this is not treated, it goes into depression and other chronic kind of mental illnesses. You know the way when you are told news of you've lost a loved one, the initial thing, it can't be, no, it can't be, I can't believe it. That's part of the whole process of coping with whatever losses. So let's not be quick to say, no, it happened, unless it goes on for long. Then that one we call it complicated grief. Then, like I said, there could be a lot of anger. Again, let the person talk about it. There could be a lot of bargaining. There's a lot of sadness. There's a lot of despair. All this, when you lose a loved one, it's a normal. Not just death, even if it's a relationship. In fact, some research is showing that loss through grief, it's more severe than death, divorce, in terms of the effect it has on a person for some people. So even in that case, let's see this is a loss the person has gone through, and let's give them the support they need so that they heal, it to aid their healing process.
After the 72 hours, before we move to the court procedures, we need to tackle who are at a higher risk in the society?
One, the elderly. They're not able to, physically, they're not able to fight for themselves most of the time because they're aged.
Yeah.
Two, persons with disabilities. Women and girls with disabilities are at a higher risk of violence. And then generally women and girls. And going back to women and girls with disabilities, we know disabilities manifest in different forms.
It
and
does.
COVA has worked with and continually works with intellectually challenged women and girls who we find that are at the highest risk because
They cannot
because of
speak for
they
themselves.
cannot speak for themselves. They most of the time have multiple disabilities. They're not able to ward off the perpetrator.
Yeah.
And these people rely on a caregiver constantly to support them. So if someone comes and violates them, sometimes she's not able to say it. And when they're not able to say it, sometimes the caregiver who will be able to notice that something is different. And that's how COVA comes in to support them.
And
Because
have you had experience where the caregiver is the perpetrator?
we've had a case one time where it is the father. We've had a case where it has been the teacher. Of course, the teacher was interdicted. We had the process with TSC. The matter is ongoing in court. People of authority in the lives of intellectually challenged women and girls have turned out sometimes to be the perpetrators. So COVA comes in to provide pro bono legal assistance and psychosocial support. We work with several clinical psychotherapists who are able to counsel them. And so when the matter, you'd ask, then how are they able to give evidence in court?
Yes.
This is why we work with interpreters. Sometimes we work with trained interpreters, we work with teachers from special schools. We'll come to court and interpret what the survivor is trying to say, because most of the time, the mode of communication is not like you and I as we're conversing. We've had cases where they're able to explain to the court what happened using a doll, because through counseling, they were able to be counseled and be able to explain, okay, this is happening. Others are able to explain clearly that say, ilifanyika, this happened to me, this is what they did, this is how they touched me. So we find person with disability, great risk. Yeah.
And during that period, how do you protect these individuals?
During the period of going to court, one, they only come to court when necessary, when their presence is required. And that is only during the period when they're giving their testimony. The hearing process may be long. There's the prosecution will give its case, the defense will give its case, but only at the prosecution stage when in person they need to give evidence. That is the only time they'll appear in court. The other time that we need to interact with them when they're going through the counseling sessions. Of course, it's several sessions, not one, not two. May go up to 4, up to 6, up to 8. That is the only time their presence is required. So you work with the caregiver, you partner with them, so that they're the go-between between the organization, the lawyers, the court, and the survivor. Yeah.
Going back to court cases and procedures, do you think that there's enough legal framework to cover GBV in the country?
So I'll start with what challenges we're experiencing when handling intellectually challenged and generally throughout the country. So in the legal process that I've seen firsthand, we have a challenge when it comes to witness boxes. It is expected in courts that there will be a witness box, but I've not seen a court setup where there's barrier preventing the survivor from seeing the perpetrator. Because you can, as I'd said initially, they're facing mental health problems in the process. It is traumatizing. And we've had cases where the survivor saw the perpetrator, collapsed.
Wow.
So there are no witness boxes. We've had to improvise with a lasso, card box. So there's no actual barrier saying, I'm preventing you from seeing the perpetrator, and you can comfortably give your evidence, explain what happened without facing the person face to face and being intimidated. That has been the challenge. Also, the challenge of cases also taking long, prosecution taking long. Sometimes the cases, the adjournments. During this COVID-19, a lot of cases were adjourned because courts have integrated through the online system. So a lot of matters have not been heard. Generally, the legal framework, we have a bit of issue with some of the provisions of the law.
Okay.
And one of the things COVID is addressing is provisions of the law that are seemingly degrading, and that may come out as a shock. But I would specifically say Section 149 of the Section 146, sorry, of the Penal Code refers to mentally challenged and intellectually challenged persons as idiots and imbeciles. Oh. It is about time that section of the law is repealed. This is a law from when? The 1960s?
Yeah.
So such provisions, how is it that it is existing today? It's quite derogatory for someone to be referred as an idiot or an imbecile. It's quite derogatory, yeah?
And yet you're looking at the same law to give you
You are looking
protection,
for the same law
justice.
to give you protection. So imagine a case where the charge sheet is drawn using that section. You can imagine how absurd that would be, right? In terms of also the legal framework that protects women or persons with disability, Kenya has not ratified one of the protocols. Generally, we call it the Disability Protocol, but it's the long name is the Protocol to the African Charter on Human and People's Rights on the Rights of Persons with Disability. It's quite a mouthful.
It is.
So the Disability Protocol, Kenya has not ratified. Many African countries have not, but this protocol brings new provisions that the Disability Act does not have. It goes into protecting several groups of persons with disability in terms of provision, in terms of what needs to happen, in terms of their education, their protection, what challenges are they facing. It also addresses the cultural aspect of disability in terms of their rights and the challenges. So this is a document that needs to be ratified and made law in Kenya. Such provisions become law and will protect them in terms of their rights, GBV, every form of violence. Yeah.
With all that in mind, what more do we need to do as a society, as the government, and most importantly, what more are you doing as an organization?
I'll start with what does the society need to do. The society needs to speak about matters, violence. I know in some societies it's taboo. These are the things that are household problems. Two, the society needs not to hide, to stop hiding these cases. And I explained a case where sexual violence has occurred, but families are exchanging money, so that it's a hush-hush situation.
Yeah.
The society needs to be more embracing towards activists who come to them and ask, we want to talk about these things. We've had few instances where our community activists or paralegals are saying, we can't go to that place.
Okay.
We're not accepted. The society needs to be a bit embracing. And lastly, I would say the society...
Before we continue,
sorry.
What do you do when the community or society does not accept you? How do you penetrate?
How do you penetrate? You work with the local leaders.
Okay.
You work with the local leaders. You know who is respected within this area. You go through them.
Okay.
Because this is what COVID has done in many of the areas. We've worked with leaders. We've worked with the chiefs, village elders to penetrate certain areas, because we know as COVID, we just can't take ourselves and say, we are here, we want to talk. But if you create champions out of local leaders, then the community will be able to be recipient to you and the conversation you want to bring about. I'd say lastly about the community is to educate our young ones, to want to be watchful of our kids now that they're at home. Be watchful, know where they're going, know what they're doing. Second, talk to our boys and girls. Most of the time when a girl becomes a teenager, during the first period, the mother will tell you, this is how you sit, this is how you clean, this is how you use the sanitary towels. But how many times do parents talk to their boys? It almost never happens.
It never happens.
You'd think that it happens during the period when they're undergoing circumcision and then they're considered men, it ends there. But a lot of the perpetrators in the prisons are men. So how did that come about? So to prevent this from happening in the long term, let the conversation begin at home. That let's educate our boys to say that when a girl says no, it is a no. This is how to treat a lady. This is how to maintain respect, so that the cycle of violence
so
does
generally
not
we
keep
empower
repeating.
men or young boys to
Exactly.
be great men. The same way we are now empowering women.
exactly the same should happen.
Okay.
At a national level, I would say there's quite a number that needs to be done based on the challenges that are being experienced right now during COVID-19 season. As first thing I say, there's no safe spaces. COVAO is mounting an advocacy campaign called Wape Kimbilio, where we're saying more needs to be done in terms of creation of safe spaces. Women are experiencing intimate partner violence, sexual violence, emotional violence, psychological violence. Where do they go when they feel like there's no one to help me? Where do they go? Because most perpetrators, we know them. We live with them. We see them on a daily basis. So if these are the people violating us, where do we go as women? There need to be safe spaces.
And the unfortunate thing is that when you've mentioned intimate partner violence, many of the partners, especially men, would say, it's my right.
Exactly.
We are married.
We are married.
Yeah.
It is up to us to decide how our matters will be dealt with.
Yeah.
Forgetting that this is a human rights violation. She has a right to security. She has
A right to say no.
If she says no, is that no accepted? It is unacceptable that if I don't like something you've done or said, the next thing I turn and hit you. So the person who's the recipient of the violence, if they feel threatened, they don't feel secure in this house or in a certain space, where do they go? The government needs to do more. Both the national government and the county government, more needs to be done in creating those safe spaces. Two, the national government needs to mount advocacy in terms of telling people we need to report cases of violence. And at the same time as they're mounting that advocacy, empower those groups that are first-line responders to matters violence. Courts, that is the judiciary, police officers, health workers, how they should be able to respond to matters violence. The government needs to collect data, gender-responsive data. And the process of collecting data, not to violate the rights of women and girls as they're doing, data that can say these are the types of violence being experienced, and based on this data, how then can we adjust the interventions? Because if during this COVID-19 period, GBV has gone up, so the current interventions then, something is amiss somewhere. So how does the government adjust the intervention to support the everyday woman and girl who's facing violence in the community so that they're able to receive support?
And especially during this time.
Especially during this time. I'd say something else the government needs to do is involve women in decision making, in the development of policies, of laws that affect them. And in the process of involving women, involve grassroots organizations. The reality is grassroots organizations are the ones supporting women on the ground. So they would know better what interventions these women and girls need, the challenges they're facing, the interventions needed that will meet their needs, that will address the challenges that they have directly. So if they're not involved, it will be just sitting in the boardroom, making decisions without knowing what is happening on the ground, what would work, what would not work. So involving women, involving organizations that deal with this on a daily basis, then we'll be able to create an entire system where we understand the problem from the ground, what interventions would work, what would not work, and how do we streamline the entire system so that everyday needs of women and girls are met where there has been violence.
And what of you as COVAO? So what is your toll-free number?
So what is COVAO doing? COVAO has several interventions. I talked of Wape Kimbilio Advocacy Campaign, where we're saying lobbying, mounting awareness and lobbying, saying that the government, national government, county government needs to create safe spaces for women and girls. COVAO is providing pro bono legal support, as I'd said, to victims of violence. Pro bono legal support being through pro bono lawyers where the matters are ongoing in court, also pro bono advice, legal advice, that sometimes we've had cases where someone is saying, I need to know what to do. I am clueless. That is where COVAO comes in and give advice. COVAO is working with community activists and paralegals who, on the ground, they're able to let us know what is happening and support. COVAO is giving basic food support, is giving protective equipment and sanitary towels to families with intellectual challenge, women and girls, and where they're extremely needy. COVAO was also engaged at policy level. We also engaged lobbying for the ratification of certain laws, for the repealing of laws like Section 146. COVAL is also engaged in that. I would say COVAL also in Kwale, one of our Kwale offices is working with adolescents and young women, empowering them, giving them economic empowerment so that they're able to stand for themselves, especially for those who have dropped out of school. In Narok County, COVAL is lobbying against FGM in the communities. Currently, because of COVID-19, we've not been able to go to the grassroots and be able to speak to the community, but we're working with the leaders and seeing how we can adjust the interventions that we've been previously having, right? Our toll-free line, I would encourage the public to reach out to us. Our toll-free line is 0800 720 553. I'll repeat, 0800 720 553.
Okay.
Reach out to us and we will support you when it comes to reporting. Should you need legal assistance, reach out to us. We'll be able to support in that respect too. But I would mostly encourage the public, speak about violence, report matters violence, go to hospital within 72 hours should an incident of rape or defilement has occurred, because through those measures that we may think are small, we'll be able to save our lives. We'll be able to save someone else's life. Where there's domestic violence, seek help, speak about it.
Thank you very much for coming.
Thank you very much for having me.
Yeah.
Okay.
Kongoi missing. Ongetien ewigi nenyone asitage ngalalen agoba COVID-19 akaimutik chikokomuch komonge.